A normal left foot X-ray. Normal left foot X-ray. A foot X-ray is a basic investigation to detect orthopedic conditions. This type of imaging is performed by a specialized technician who uses a special machine to take the images. The technician is usually employed by a healthcare provider or radiology department. Typically, 3 different views of the foot are taken, each showing the same part of the foot. Taking 3 different pictures is considered a normal left foot X-ray. A typical foot X-ray takes about 1 minute. The images are taken from above and below the foot. The technician will take several photographs to help determine any problems with the underlying bone. The image is then generated and interpreted. If the X-ray shows a fracture, the doctor will likely recommend surgery to repair the injury. An X-ray can detect bone fragments and other abnormalities in the foot, but it does not reveal the cause. Foot X-rays are relatively safe, and while there is a small risk of exposure to radiation, this is usually minimal. The radiologists use a limited amount of radiation during a foot X-ray to achieve the best results. It is important to note that pregnant women should disclose this information to the X-ray technician. The X-ray technician will have instructions for pregnant women, and parents can help prepare their children. The X-ray of the foot does not require special preparation. However, children may be asked to remove any clothing or metal objects they are wearing. A pregnant woman should tell the X-ray technician if she is pregnant. The procedure takes approximately 15 minutes and the exposure to radiation is less than a second. You may have to wait for a couple of minutes, but the actual exposure time is only a few seconds. A foot X-ray can be helpful for identifying the cause of common symptoms. A foot X-ray can reveal broken bones, dislocated joints, and other conditions. It can also be used to plan surgical procedures or assess the effects of surgery. The image generated is high resolution. Hence, a foot X-ray is beneficial for a patient. A healthy foot will have no visible defects and will be able to show everything. A normal left foot X-ray is usually a standard procedure, with minimal risks. Although a foot X-ray is safe for most people, there is still some risk. The exposure to radiation is greater in developing babies, so a pregnant woman must notify the X-ray technician if she is pregnant. Moreover, a child can be prepared for the procedure by explaining what will happen during the procedure to him or her. A foot X-ray can help diagnose common symptoms. A normal foot X-ray can also detect dislocated joints or broken bones. A properly functioning foot X-ray can also help your doctor plan surgical procedures. It can detect tumors and cysts, which can be early signs of disease. A child's foot X-ray can also show a child's development. An X-ray can help doctors diagnose a variety of disorders. During a normal left foot X-ray, the 4th metatarsal should be aligned with the medial border of the cuboid. In addition, diastasis of the joint is not visible on a weight-bearing view. In a normal left foot X-ray with these features, the 4 metatarsals are well aligned and sesamoid bones of the first toe are seen. During a normal left foot X-ray, the X-ray technician will view your foot from above and below. The procedure takes a minute. The X-ray image will show all bones, including the tendons and ligaments. It will also show the bones of the foot. During a foot X-ray, the doctor will examine the joints of the feet and the bones of the feet. The foot X-ray will show the different bones of the foot. A fractured foot will usually have a chip or crack in the bone. It will also be X-rayed if the X-ray shows a full foot fracture, which is a serious medical condition that will need to be treated by a specialist. The X-ray image is used to determine the exact location and extent of the fracture.